Bismillah wa salatu wa salamu ala Rasulillah wa ala alihi wa sahbihi wa ala. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm joined here with MCA's Health Committee member, Dr. Uzair Munshey, and Dr. Yusuf Ahmed from Chicago, who's an infectious disease specialist. What I want this live session to clear up is any doubts that we may have as a community in regards to the decision that we took as MCA. First and foremost, just want to clarify that the decision that we did take of suspending our congregational activities, our prayers, our Salatul Jumu'ah was a very difficult decision to take. There were many meetings which took place, many hours which were put into it, many suggestions which were given, and many things that were decided prior to the eventual cancellation of Jumu'ah. Those who were following, first we, in order to minimize the crowds, we increased the khutbahs which we were going to have to 4, decreasing the time for the khutbah, the time for the salah, etc. Eventually, when the situation worsened, per the advice of our health committee, we eventually did have to cancel. The basis of that being, and just to let you guys know as well, Uzair and Yusuf, the Prophet ﷺ actually, when there was difficult weather, the Prophet ﷺ advised the companion who was going to call the adhan to include in the adhan "Sallu fi buyutikum," that pray in your houses. The Prophet ﷺ, recognizing the difficulty that the companions would have gone through. Obviously, the virtue, the blessings of being associated to the masjid, being those who occupy the masjid, we all know about. But it is hoped that when we do adhere to situations in which the Prophet ﷺ also allowed salah at home, we get the virtue and we get the blessings and we get the reward of that as well. The fuqaha, they actually deduce from these type of situations a principle which goes such that the prevention of harm precedes the acquiring of benefit. در المفاسد أولى من جلب المنافع, that the prevention of harm precedes the acquiring of benefit. So acquiring of benefit in this situation being the superiority of salah in the masjid with jama'ah. But the harm in this situation, as we have been advised by you guys, is that it is far superior, and it's something which is never dealt with before. So from a Shari'i perspective, it's something which was done at the time of the Prophet ﷺ for something which was far less. This doesn't mean that we stop salah in congregation. No, we should have it in our houses. Take this as an opportunity to make every house a masjid. Call out the adhan, call out the iqamah, get your family together. Everyone should know that at 6:45 a.m. we're going to have Salat al-Fajr. Everyone should be awake. Everyone should be in the room for Salah. Everyone should be ready for Dhuhr, Asr, Maghrib. Have a congregational prayer inside your house. In order to replicate that, call out the adhan, call out the iqamah, do all of that. And inshallah, Allah will reward us. All of us desire to come to the masjid. We want to come to the masjid. It was one of the most difficult decisions, wallahi, that I have made in my life, of postponing or suspending Jumu'ah, of suspending our activities, our congregational salahs within the masjid. The most difficult decision that me and Sheikh Abdullah Amin had to make in our lives. When we were discussing this Thursday night, when this situation came up, we both just looked at each other, and my mouth was open, and I was at a loss of words. And his response was, "Listen, hold on, I got to think about this." So it's extremely difficult, but it is something which there is precedence to do, and I think that is the wise situation as advised by you guys.
Assalamu alaikum. Thank you, Imam Abdullah, for that. I think most people watching the video would know who I am. I just want to add to that, you know, there is a medical treatment being advised. This is not a medical treatment at the individual level. This is a medical treatment at the community level, you know, and that's the difference between primary care and public health. In primary care, we deal with the individual, we treat the individual. Public health treats the community. And Rasulullah said, you know, and there's a hadith in Jami Tirmidhi, authenticated, narrated by a Sahaba named Usama bin Sharik radiyallahu anhu, that Bedouins came to Rasulullah and asked him, shall we treat our ill? He said, yes, use remedies, and Allah did not make a disease except that He created a remedy for it, and except for old age, which is, you know, essentially kind of the meaning of the hadith there. But in this case, the treatment that's being recommended, which I'm sure many of you have heard of, called social isolation, the mitigation tactic, is the metaphor that I think fits best is, you know, I'm sure many of us living in Ann Arbor have taken a canoe down the Gallup or down the Huron River. When you take a stroke in the canoe, you see the effects of that a few, you know, feet down, right? You turn left, try to turn left, doesn't turn right away. It turns left after a few strokes later. We're to the point that many beginners will overcorrect or overturn and be riding around in circles. And so this is a treatment we have to wait on. And to that end, to help us kind of explain in the terms of, you know, someone who has more expertise, we invited Dr. Yusuf Ahmed, who graduated from medical school at the University of Illinois, Chicago, and did residency in internal medicine at St. Louis University, followed by a fellowship at the University of Kansas in infectious disease. And his academic interest during that time was actually pandemics. And he's been following this for quite some time. And I've been following along with him. Had I not learned some of the information I learned over these last few weeks, even now, you know, when we were sitting there Wednesday night when we were talking about it, me, Abdullah, both Imam Abdullahs were up till 2, 3 a.m. texting, trying to figure this out, feeling like trying to take every step we can to make this not the case, that we don't have to shut down the masjid to recommend something else. To the point that Friday or Thursday night, when we did make the decision to stop Jummah, we only made it because we got the notification at that point that we had 2 confirmed cases in Washington County. Up until then, we were planning to go forward with it. And then we got to confirm 2 confirmed cases in Washington County. And then we said we have really no basis that we can continue this because of the harm that will be involved. And that's kind of an introduction, and let Dr. Yusuf Ahmed talk more about the technical aspects. And he has actually spoken with people with experiential information as well. So.
Okay, awesome. Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. Thank you for giving me a chance to speak to your community. I'm going to start off with an apology. What I have to say is very scary, but we are unfortunately in a rather unprecedented situation in any time in recent human history. This infection, what we are facing as a community, as a country, is so terrible that I have no other way to present this information but to tell you the truth. This COVID-19 infection is one such that it has an incredibly high mortality, meaning that for the patients who get infected, they get infected and can pass incredibly rapidly. In fact, just an hour ago, I was talking to one of the heads of a large facility in Washington, one of the many facilities that have been hit by this. And they're seeing cases in which people are dying within 8 hours of developing minor respiratory infections. Minor respiratory symptoms, my apologies. Because this infection is running unchecked with our medical community being unable to provide any kind of effective treatment option. And let me explain that. Generally, when we have infections or we have these kinds of epidemics, like say with the flu or swine flu, MERS, or SARS, or any of the other type of infections that have happened in recent years, we usually have some amount of either moderately to significantly effective treatment options that we can present to patients. We can stop the infection, the viruses, from replicating actively within the body, let alone going for cure for some individuals for some of these kinds of infections. Or their risk of running rampant through a community is low, because those who get infected, such as with MERS, have a tendency to become so sick so quickly that they will die and be unable to pass the infection along to the community. However, this COVID-19 infection is a nightmare scenario, because what we are dealing with is an infection that has, for the younger members of our congregations, of our communities, they will be infected and not know it, and be able to go about their everyday lives, passing the infection along to those who are truly at risk of having the worst case scenarios. And for those who are at risk of having the worst case scenarios, people over the age of 50 or 60, people who have lung or respiratory issues, people who are immunocompromised, these people will get these infections from asymptomatic individuals and then proceed to have devastating consequences. And we are in this situation where we simply do not have the resources to deal with a full-scale pandemic in our communities. Our healthcare systems have already been devastated by the flu this year. We are beaten down. We generally have the summer to recover, to build up our resources, hire more people, and effectively see how we responded to the flu from the year before to be able to better prepare for our response for the next year. But we are not getting that time any further. Our hospitals are running at capacity, and our ability to deal with the surge is minimal at best. I have worked at multiple different high-level academic institutions. And at most of the high-level academic institutions that I've worked at, the places where you would send your worst cases, their surge capacity was 5 beds, 10 beds. And we are talking about a situation in which, if left unchecked, people needing hospitalization in the hundreds to thousands. Right now in Washington, they are building tent city hospitals in which the hospital parking lots are being converted to staging areas and areas for which to treat as many people as humanly possible with whatever we can offer them. So this situation that we're in, and the infection, and what we're seeing, what we're learning coming out of China and Italy, and seeing how well the South Koreans have responded, that is the reason why we're making the decisions here in the US. And with the full knowledge that right now, we are at the precipice of a truly devastating situation. The reason why I not only applaud the decision to cancel Jumu'ah and to cancel the congregational prayers, but why it honestly makes me feel proud to be a Muslim, to see our communities responding and sacrificing so much to try and respond to this, is because there's simply anything else we can offer. And by doing this, we can slow the rate of infection within a community long enough to develop a treatment. Because that's really what we're doing here. If we slow the rate of infection, inshallah, within months, we will have treatment options. They are being developed. There's phase 2 trials happening. We have promising results, and the chance to turn this from something devastating to just something difficult. And trust me, in our current healthcare system, we are accustomed to difficult. but all of us are afraid of devastating. If we slow the rate of infections within communities by keeping our asymptomatic younger people away from the elderly people who will become infected and have terrible situations happen, what we will do is we will buy time. And we in the medical community are not asking for a lot of time. We are asking for, if we can push off as much of this disease as possible for just months, we have the chance to be able to actually do good when somebody presents to the hospital. Because right now, we are already getting overwhelmed. In my hospital, I have a full ICU, a nearly full hospital floor, and an ER that literally 2 days ago had for a 27-bed ER, I had 45 patients there. And that's before we have the massive influx that we're expecting from this disease. The simple truth is this: if we do nothing, people will die at rates in which I will not be able to help. By doing the sacrifices that we're doing, we might have the chance to where I don't have to sit in a hospital room and decide, am I going to help this person or am I going to allow them to drown in their own fluids as their lungs fill up with water? When I started this career of mine, I started it with the hopes of going to other countries and being the person that helps develop their systems enough that when something like this devastating happens, that I can help a lot of people even without seeing them, by just building up their resources and helping their public health systems be more robust to handle more issues. But the simple fact is, this early in my career, I'm in this situation here in the United States, where I am counting the days until until our outbreaks truly worsen, and they will. And whatever we can do to help avoid it or to just push it off, just a little bit of time is all we need. We will have options soon, but just a little bit of time helps me do so much more good.
Jazakallah khair. I think that helps a lot explain why we're taking such a hard line here, and talking about flattening the curve, social distancing terms you guys all have heard. And so I think we are going to be reevaluating every week, and so it's not something anybody wants to do, right? But I think that helps. So if Mufti Abdullah, if you can close us off there.
Absolutely. Jazakallah khairan, both of you, Uzair and Yusuf. Your time is much appreciated. And absolutely, it's a difficult decision for all of us. The masjid being technically our lifeline. It's where we attach ourselves to, our community being our lifeline. This is what we have. So not coming to the masjid, not coming for Jumu'ah, it doesn't feel normal. Someone not going but still having the option to go, that's different than a person that wants to go but now he cannot go. So it's extremely difficult for all of us, but this is something that, as explained, these are the steps that we have to take. So may Allah subhanahu wa ta'ala make it easy for all of us. And Jazakallahu khairan for both of your times.